Hi everyone, this is Jennifer Bond. This is my community analysis for Palm Harbor, Florida. This is my first time narrating a PowerPoint and making a video, so please bear with me. Palm Harbor was established in 1860. That's when the settlers began moving in. At different points in time, the city was once known as a pioneer town, farming center, a developer's dream, resort town, and a college town. Palm Harbor was once rich farmland, good for farming, fishing, and it had an abundance of citrus crops, but today it is a suburban metropolis filled with a good mixture of subdivisions, businesses, and recreational activities. Almost 60,000 people call the city of Palm Harbor home. Most houses and businesses throughout the city are well kept and are nice in appearance. Roads are maintained and there is limited trash polluting the community. The city has K through 12 schools with good ratings, and they are within close proximity to higher education facilities. Residents have access to medical care via nearby hospitals and clinics. Palm Harbor has an array of grocery stores, churches, pharmacies, restaurants, clothing stores, home goods stores, and recreational activities such as beach areas and nature parks for residents to utilize. Other places not located in the city are just a short drive or bus ride away. Compared to neighboring cities, Palm Harbor has less crime and better schools, but housing is much more expensive. The population of Palm Harbor residents is almost 60,000 people. Compared to neighboring cities such as Clearwater, who has 110,000 residents, and cities like neighboring Tarpon Springs, which has 24,000, and Oldsmar at almost 14,000, Palm Harbor falls in the middle range in terms of occupancy. Residents of the city are mostly Caucasian, with over half of them being between the ages of 18 and 64. Unemployment rates are lower for the city at 4.3% than those in Pinellas County, than the whole county at 5.3%, and the state of Florida is at 5%. The poverty level for residents in Palm Harbor is 8.7%, which is lower than the county's rate at 15.2% and statewide at 16.5%. Possible health concerns for residents could be related to tobacco use, sun exposure, water safety, and driving and bicycle safety. The city of Palm Harbor has after-hour clinics, walk-in clinics, primary care physicians, assisted living and nursing facilities, and a hospice center. Within a short drive are two hospitals, which are Meese Countryside Hospital in Safety Harbor and Florida Hospital North Pinellas in Tarpon Springs. The Clearwater Free Clinic in the Tarpon Springs Health Department is available for those who need financial assistance with treatments and medication. Healthy People 2020, the top 3 that I selected were to reduce the proportion of adolescents and young adults with chlamydia. 4 out of the top 5 communicable diseases in Pinellas County are sexually transmitted, and the number 1 is chlamydia. There is an occurrence rate of 423.3 people out of every 100,000. The second one I selected is to reduce coronary heart disease deaths. The number 2 cause of deaths for Pinellas County residents is heart disease at 22.7, leading only by cancer at 22.8%. The third I picked was to reduce tobacco use in adults. During the windshield survey, I observed numerous people who were smoking cigarettes. excuse me, for government and public policy, being that Florida or Palm Harbor is unincorporated, there are no designated city officials, such as a mayor or council members. The Pinellas County Commission governs the community, and the Palm Harbor Community Services Agency oversees the library and recreational department. The Pinellas County Commission provides the funding for the city, and since 1985, state officials provided Palm Harbor with a special status that protects the city from surrounding municipalities and allows residents to pay a special housing tax that provides additional amenities that the city needs that are not supplied by county and state funding. The city is stable, well-maintained, and has an appropriate amount of emergency and medical services. There are no issues of concern. As far as community needs for the city of Palm Harbor goes, the top ones I selected in order of priority are sun exposure risk leading to possible skin cancer due to lack of sunscreen, sunglasses, clothing, hats, etc. from residents. Florida has the second highest melanoma rates in the entire country due to the abundance of sunshine. Skin cancer is also the most common type of all cancers, with an estimated 700,000 to 1 million people diagnosed annually. Number 2 I selected was to reduce the risk of drowning, teach swimming and water safety. In 2013, Florida had the highest unintentional drowning rate for children under the age of 4, with an occurrence of 7.5 out of every 100,000 people. For children ages 1 through 14, Florida is second in the nation for drowning, with a rate of 2.54 for every 100,000. Since Palm Harbor is located on the Gulf of Mexico, Lake Tarpon is in the center of the city, and many residents have pools. Water safety and knowledge are essential. Number 3 is to reduce the number of smokers in the community, teach health risks and smoking cessation methods and support systems. During the windshield survey, many people were observed smoking cigarettes. Cigarettes resulted in the deaths of 430,000 people nationwide, with 28,700 of those being Florida residents. The adult smoking rate for Pinellas County is 19.3%, and for the state of Florida, it's 17.1%. The fourth community I selected was limit fast food consumption, teach healthy eating habits. Many people were spotted in the drive-thrus and eating at fast food restaurants during the windshield survey. With many busy schedules with today's lifestyles, obesity is at an all-time high. 65% of Floridians are at an unhealthy weight, and 1 out of every 3 kids are considered overweight or obese. Number 5 is lower the number of heart disease deaths among residents, educate residents of the risk, and encourage healthier habits. Heart disease is the number 2 cause of death for Pinellas County residents at 22.7%. The 6th community need I chose was to lower the occurrence of sexually transmitted diseases and to teach safe sex practices. 4 out of the top 5 communicable diseases in Pinellas County are sexually transmitted, and number 1 of those is chlamydia. The global issue I chose that affects the community as well as the world is smoking. Smoking is the single largest cause of preventable premature deaths in the United States and results in 430 deaths annually. Tobacco kills about 6 million people worldwide. More than 600,000 of those deaths are caused from secondhand smoke. Preventative measures for smoking reduction across the globe some of these are advertisement bans, cigarette warnings and education with visuals of the toxic effects, higher taxes on cigarettes, smoking cessation devices, techniques and support, and smoking bans and limitations on smoking in public places.